uses?
It did so, but at that time, actually, and I think it was starting to shift closer to the end of my time there, but they very much had substance use counseling and mental health counseling separated.
Oh, okay.
So it's kind of interesting. It was at times kind of a stay in your lane, which you can do EMDR with substance use as well. There are
Yeah.
certain ways to use that, but closer to the last period of time I was there, it was starting to blend a little bit more, which I
Yeah.
preferred because to me it's kind of hard to separate all this stuff out.
Yeah, we've had multiple substance use professionals where the bulk of the conversation, for anybody who's worked with it for any amount of time, we know the root of really, when you dive into any addiction and you remove the substance, you're
Yeah.
dealing with all of the muck and the mire of generational traumas, but predominantly, like, if we just call it trauma, right, and getting in
Sure.
there and sorting out some of those dynamics. But at that time, you were in the addiction side of treatment,
Correct.
and then
Yes.
transitioned to trauma treatment
Yes.
predominantly.
Right.
What's the main, I don't want to be insensitive here, but the drug of choice that's popping off with the army in South Korea?
Alcohol, because that's really what's readily
Yeah.
accessible.
Yeah.
Yeah, so that was the primary one for sure.
Yeah. And I imagine at that point, a lot of the assessments are to make sure that they're fit for duty and these kind of things.
Yes.
Yeah.
Yes. That was another piece that was kind of an adjustment, from a social worker, therapist, person first, which still was person first, but you also have to consider the mission essentially is kind of your client, which is kind of, I had to wrap my head around.
Yeah. What's the, I guess, the mental gymnastics surrounding some of that?